Good afternoon, Mayor Jones and members of City Council. Before I get started, I just want to share something. I just would like for everybody here to put yourself in a mentality of an open mind. Most of you, well, everybody here has an appointment here that you were elected by the city and your council and your representatives, your constituents, but you don't have the lived experiences that a lot of my battle buddies have. You don't have the lived experiences that the mayor has to lead and to push things forward. So I would just ask that of you. So good afternoon, Mayor Jones and members of City Council. My name is Maira Carrier. I'm a 10-year Army combat veteran, community advocate, and recently I was appointed to the Veterans Advisory Commission. Today I want to talk about what stability actually means for a veteran. Stability means being able to live near medical care, transportation, family support, and near systems that help veterans stay healthy, employed, and connected to community. But right now, many veterans are using VASH vouchers don't truly have that choice, because even after qualifying for housing assistance through the VA, they're still being screened out before they ever get a fair opportunity, and the data reflects the consequences. More than 70% of veterans using VASH vouchers in San Antonio are concentrated in census tracts with high social vulnerability. Nearly 84% in multifamily housing, and only around 8% of rental listings in San Antonio currently indicate they accept housing vouchers. This is a reflection of barriers we have allowed to exist in our city, Councilman White. And these barriers disproportionately affect veterans who are already vulnerable. 3/4 of the Opportunity Home in San Antonio VASH voucher holders have disability, more than half are elderly, and 17% have children. For veterans with PTSD or service-connected trauma, environment matters. And to those that have concerns about the system itself, I hear you. If there are inefficiencies, delays, or frustrations with the housing process, then let's work together to improve the system. Because as a veteran, I understand what it feels like to navigate broken systems. I know what it feels like to wait months for care. As a veteran, I know what it feels like to navigate mental health challenges through the VA. And as a female veteran, I know what it feels like to finally ask for help, finally advocate for your health, and then hear that the next OBGYN appointment is 6 months from now. I know what it feels like to walk into Audie Murphy carrying the fear and knowledge that fellow veterans have already taken their own life in that very parking lot. Veterans are already navigating barriers, traumas, delays, and exhaustions every single day. They should not be paying the price for a housing system that they did not create or break. Less than 1% of Americans choose to serve in the United States military, and today we're discussing a policy that impacts less than 1% of rental properties in our city. Today you have the opportunity to move San Antonio closer and to help veterans. Thank you.